Following are risk factors for cancer, the second most common cause of early death in essentially all industrialized nations.
The first risk factor is again family history. There are some cancers that have a genetic predisposition and other cancers that don't. Next, smoking. Smoking increases the risk of at least 10 different cancers. It's widely believed among smokers that stopping will cause them to gain weight. In reality, only a small percentage of people do. Next, lack of exercise. Exercise reduces the risk of colorectal cancer. It may reduce the risk of other cancers. Being overweight may increase the risk of 5 cancers, namely cancer of the kidney, uterus, breast, colon, and gallbladder. As you can see, being overweight dramatically impacts our health. But we must not reduce it by using diets or methods that would increase other risk factors for heart disease and cancer. For example, as you will soon see, high saturated fat diets are associated with increasing risk of several cancers. Next, stress. Highly stressed people have a significant increased risk of colorectal cancers. Highly saturated fat diets. High saturated fat diets may increase the risk of prostate, uterus, breast, colon, and lung cancer. Any program that would teach you that unlimited fats are a good way to lose weight may be recommending a method that could increase your risk of cancer. Perhaps such a diet could be used for a short time period, but long-term adherence would be very risky and is not recommended by NUTRILITE Health Institute. The seventh risk factor for cancer is inadequate fruit and vegetable intake. Fruits and vegetables are loaded with hundreds of antioxidants and phytonutrients, many of which haven't even been identified yet. Adequate fruits and vegetables may reduce the risk of over 14 cancers. Supplements are helpful, but they can't replace everything that's in a diet. Any diet that would recommend to you less than 5 to 7 servings of fruits and vegetables every day should be avoided. Excessive alcohol is another risk factor. We define this at NUTRILITE Health Institute as being more than 1 or 2 drinks in a day. Additionally, alcohol shouldn't be consumed more than 5 days a week so that the liver and other tissues can recover from what is essentially an oxidative attack. High salt intake. The head of the National Cancer Institute in Japan informed me that they believe that this is significantly responsible for the high stomach cancer rate in Japan. Pollution. This has been associated with many upper respiratory cancers. Smoked or charred foods. Smoking or barbecuing, especially over charcoal, is covering food with free radicals and carcinogens. Intake of such foods should be limited. Excessive sunlight. This is believed to be associated with many skin cancers. Those who have been sunburned multiple times have an increased risk of skin cancer. Vitamin D deficiency. This has been shown to be associated with several cancers as well. And then finally, certain infections. Human papillomavirus, which causes venereal warts, a very common sexually transmitted disease, is believed to be responsible for the vast majority of cervical cancer. Hepatitis C is believed to increase the risk of liver cancer. Can you see that we have significant control over the cancer risk factors? Of the first 7 risk factors I mentioned for cancer, 6 are the same for heart disease. They are family history, smoking, lack of exercise, being overweight, stress, inadequate fruits and vegetables in the diet. By reducing one risk factor, you may be reducing the risk of 2 chronic diseases.
Is being a little overweight really so bad?
Well, a few pounds overweight is not a significant risk. But remember that being even 20 pounds over your ideal weight is considered a risk factor for both heart disease and cancer. Look at it another way. If you commit right now to losing 20 pounds over the next 12 months and keep it off forever, you will have accomplished something that few dieters ever do. And you will have done something that nobody in the diet industry ever wants you to do, and that's to move towards optimum health. Is there a common theme with all the risk factors for heart disease and cancer? Surprisingly, the answer to that question is yes. Almost every risk factor for heart disease, cancer, and diabetes is associated with elevated C-reactive protein, which is a marker for inflammation. Our modern lifestyles induce an inflammatory effect on our bodies. It's easy to imagine that pollution or smoking are inflammatory to our bodies, but the same is true for being overweight, lack of exercise, and essentially every other risk factor we discussed in the risk factors sections for heart disease and cancer. There is preliminary research to indicate that many health conditions are associated with inflammation. Some of them are heart disease and cancer, as previously mentioned, but also Alzheimer's, another disorder which is increasing rapidly over the last 10 years. Parkinson's, ulcerative colitis, arthritis, asthma, multiple sclerosis, and type 2 diabetes, as well as allergies. Emerging and some preliminary research is showing that reducing inflammation may reduce the incidence of some chronic diseases. There are many studies that have shown that people who take aspirin daily have reduced their risk of heart attacks. It was originally thought that aspirin's benefit was due to the thinning of the blood and thus preventing clot formation in the coronary arteries. But aspirin is an anti-inflammatory and may be decreasing the incidence of heart attacks partially by reducing inflammation. Interestingly, people who take anti-inflammatories like aspirin also have reduced risk of colon cancer.